In this podcast episode, Dr. Robert Abbott, a clinician focused on autoimmune conditions and dietary interventions, discusses the complexities and challenges of studying restrictive diets like the carnivore and lion diets compared to more widely researched diets such as vegan and ketogenic diets. The conversation delves into the clinical rationale behind these diet studies, participant criteria for ongoing research, the methodology being used, the necessity of examining both subjective quality of life outcomes and objective physiological markers, and the broader implications of diet in managing systemic autoimmune diseases like rheumatoid arthritis and inflammatory bowel disease. Dr. Abbott also addresses cultural and scientific gaps in nutritional research and the difficulties of implementing such studies ethically and rigorously. Dr. Abbott begins by acknowledging the difficulty of maintaining health compared to falling ill, emphasizing the effort required for wellness in a modern context where natural lifestyle factors are less present. As a clinician, his focus is on helping patients feel better through tangible daily actions, with diet being the most significant modifiable factor. He stresses the importance of active patient engagement and ownership in health creation, viewing diet as more than just a passive intervention like medication or supplements. The conversation highlights the limitations of conventional medicine, which often relies heavily on pharmaceuticals with notable side effects, especially for chronic autoimmune diseases. Diet, particularly restrictive elimination diets, presents an opportunity for meaningful impact at a lower risk profile, although it requires careful, intentional application and monitoring. The lion, all-meat diet and the broader carnivore diet are viewed skeptically by many due to their restrictive nature, making them difficult subjects for scientific study. Dr. Abbott compares the situation to the extensive research on vegan diets, noting that despite veganism being nutritionally challenging without supplementation, it has been studied in numerous randomized controlled trials. This contrast exposes a double standard and a significant research gap. He points out that while vegan diets often lack certain nutrients without supplements, carnivore diets provide high bioavailability of essential micronutrients such as vitamin A and B12 inherently. Despite this, plant-based diets enjoy greater acceptance and study funding, while animal-based, restrictive diets remain underexplored due to factors like lack of patentability and academic interest. Dr. Abbott discusses his current study focusing on two systemic autoimmune diseases, rheumatoid arthritis, RA, and inflammatory bowel disease, IBD, specifically Crohn's disease and ulcerative colitis. These conditions, while affecting different tissues, share systemic inflammatory characteristics. He emphasizes that although autoimmune diseases are grouped differently in conventional medicine and treated by separate specialists, underlying causes may be similar, and dietary interventions could have cross-condition benefits. The severity and complexity of these diseases justify exploring novel approaches beyond heavy immunosuppressive medications, which carry significant side effects and high costs. He stresses that such diets are studied as therapeutic, short to medium-term interventions rather than permanent lifestyle changes. The podcast details the design of Dr. Abbott's ongoing randomized controlled trial, comparing the lion diet, ketogenic diet, and a control group maintaining their baseline diet with a delayed intervention. The study is pilot in nature, aiming to establish feasibility and gather preliminary data while prioritizing participant safety and real-world applicability. The trial's duration includes an initial on-ramp phase where participants transition to a low-carbohydrate, paleo-like diet before randomization into either keto or lion diet arms for 8 more weeks. The control group later crosses over to a diet group after a delayed period. To reflect clinical practice and ethical considerations, participants can voluntarily cross over diets at midpoint based on tolerability and response, with analyses planned both by intention to treat and per-protocol approaches. The study heavily emphasizes participant support to reduce decision fatigue and improve adherence. Dr. Abbott addresses the challenge of choosing meaningful outcomes for dietary intervention studies. While objective physiological markers such as blood inflammation measures and stool analyses, including calprotectin and microbiome changes, are collected, the primary outcome chosen is a validated quality of life measure that captures physical, emotional, and functional health. He defends this choice, arguing that if patients do not feel better, objective improvements alone are insufficient to justify an intervention. The study collects metabolic, micronutrient, and lipid data to observe varied physiological responses, since people can react differently metabolically to the same diet. The inclusion of diverse markers alongside subjective assessment aims to provide a comprehensive picture of impact. Restriction and elimination diets are contextualized as therapeutic tools used specifically for individuals with significant inflammatory or autoimmune disease burden. Dr. Abbott highlights the difference between recommending such diets for those with serious systemic illness versus general population use. These protocols are not meant to be lifelong or wholesale lifestyle endorsements, but temporary, targeted interventions often used to gain remission or improvement that can then guide further management. He notes that patients sometimes report high sensitivity to various foods, including spices, reinforcing the need for careful dietary control and investigation of deeper underlying causes, such as environmental toxins like mold. The concept of buying time with restrictive diets to stabilize symptoms and then refine long-term management is underscored. An interesting element of the discussion is Dr. Abbott's use of AI tools to comparatively analyze the micronutrient profiles of vegan versus carnivore diets. He reveals that initial AI responses tend to be diplomatic or hedging regarding the carnivore diet's nutritional adequacy, but with directed querying, AI analyses highlight considerable nutrient deficiencies in vegan diets without supplementation versus more nutrient-dense profiles in carnivore diets. This discrepancy illustrates biases in nutrition science discourse and provides a rationale for rigorously studying carnivore diets in controlled, clinically relevant contexts. It also emphasizes the need for better scientific understanding rather than ideological dismissiveness. Throughout the conversation, the speakers reflect on the paradox of modern life, where abundant comfort and convenience ironically make maintaining health more challenging than before. Natural physical activity and diet patterns are disrupted, increasing the importance of intentional lifestyle and dietary interventions. The funding landscape and academic priorities do not align well with studying non-patentable, dietary-based health interventions, particularly restrictive animal-based diets. Dr. Abbott praises pioneers who have advanced such research despite obstacles and advocates for clinically rigorous studies that combine scientific robustness with practical clinical application. He also touches on the interplay of philosophy, personal empowerment, and the patient's lived experience as critical to meaningful health outcomes beyond mechanistic metrics. Dr. Abbott invites listeners with rheumatoid arthritis or inflammatory bowel diseases, Crohn's disease, or ulcerative colitis, interested in participating in the study to apply. He notes that eligibility criteria are necessarily specific to ensure scientific validity, which can be frustrating but is essential for rigorous research. The study is designed to include multiple cohorts with rolling enrollment to enhance data robustness. Participants will receive structured support, regular assessments, and the opportunity to engage in real-time data sharing and updates throughout the research process. The ultimate goal is to generate foundational evidence to inform clinical use of diet as an adjunctive therapy for systemic autoimmune conditions.